Hey again, who am I? I am nobody. This is Sober October Daily Vlog Update number 25. All my Sober October stuff is good. Still mastered my domain, although I don't think that's going to last to the end, but fingers crossed. I guess I got a week to go. This is the 25th, 31 days, right? Yeah, Halloween. So, um, it's a little windy, hopefully not too bad. But today, I thought I'd talk about anxiety. I was supposed to go downtown and potentially do street interviews, but I don't know, the weather isn't as nice as it was supposed to be, so I kind of got put off with it, and my arms are sore from yesterday. So we'll talk about anxiety. So anxiety is normal. About 30% of adults will have some kind of anxiety condition in their lifetime. Uh, Anxiety is the anticipation of future concerns or events. It's also, anxiety is an out of proportion reaction to a situation. Um, yeah, so just an overreaction, right? Like, I can't read my own writing. It's pretty sad. Um, yeah, and it renders you basically unable to function normally. So it screws up your daily life and routines. Um, Kind of had to go back and forth on this one. So what is anxiety? What do you feel? So you feel nervous, restless, tense, fidgety. Like you'll probably notice me swaying a lot, going back and forth. That's my anxiety, right? Just not, pumping the leg, not being able to sit still. And sense of impending panic or doom. Increased heart rate, rapid breathing, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry. So you tend to fixate, right? When your anxiety peaks, it's usually because of a thought or something you can't let go of, right? Mine's a little different at times. Like I do have triggers, but sometimes it's just random. Sometimes it just comes on for seemingly no reason. So it's kind of why I can't do much. Um, so yeah, and trouble sleeping, that's a big one. My insomnia has been bad all month. That's the one thing I was hoping would change with the Sober October is coming off everything after the withdrawal passed and I'm past all the withdrawal symptoms. I thought my sleep would be better, but it's still terrible. So probably depression related. GI problems, difficulty controlling worry, and of course, when you have anxiety and you're used to having it all the time, you avoid your triggers, right? So um, we'll dip right into the conditions here. So agoraphobia is the first one, and I can speak a lot on that because I've had it twice. When I first had it, I was 21. The ex was pregnant with our kid, and I was taking a new medication, and that brought it on. But so the weed anymore, really, or didn't for a very long time. And now that I do, I don't. I do very small THC amounts. It's more CBD than weed. So, but yeah, so the medication brought it on. So that one was kind of easy to fix. I was only like homebound, locked in my apartment for like, I don't know, 5, 6 weeks. I couldn't leave. And once I realized it was the medication, I just stopped taking it and then I was fine. So, but looking back, all of my original anxiety was probably just my subconscious and, my ex being pregnant with our kid and having to be a dad and stuff. I don't know. It makes sense. I just didn't realize it was consciously, right? So, and the second time I had agoraphobia, it lasted like 10 months. But I was in my 30s then, and that was pretty bad. That was before you could have everything delivered to your house. So sometimes anxiety can be caused by a medical condition, like a physical medical condition. Um, Generalized anxiety disorder, persistent excessive anxiety towards activities, events, even ordinary routine, and it's difficult to control. So that's kind of more where I fit, more or less, because it can come out of nowhere for no reason, and it really sucks. Um, yeah, it affects you physically a lot of the time, and usually, anxiety is often comes with other mental illnesses, right? So depression is obviously depression and anxiety. They're like half brothers, half sisters. Like they almost go hand in hand. I find with most people, right? You tend to have one, you get the other two for some length of time. Not always as bad as mine. Mine are pretty persistent, but Panic disorder, that's basically just having the full-on panic attacks, which is what I had to begin with when I started to have anxiety. Um, the worst one I ever had, my ex called the paramedics because I thought I was having a heart attack. Like, it mimics heart attack symptoms when you have a full-blown panic attack, so it can be, you can obviously think something's wrong with your heart. But the freakiest thing I still remember to this day, I can't get over it. I was looking at my hand and it didn't exist. Like, I could not feel it at all. You could have hit it with a hammer and I wouldn't have reacted. Like, there was no feeling sensation whatsoever. It's not numb, just no feeling at all. It was very bizarre. Freaked me out pretty bad. Social anxiety is the big one everyone deals with today, right? So, viewed as embarrassment, self-consciousness, and being judged negatively by others. So, social anxiety is a big one. I have that on some level as well. Just and it kind of relates to the agoraphobia a bit. Like, you just have to push yourself, right? Like, you have to get out. You have to be around people. I know it sucks. I hate it too. Like, but if you don't do it, your thoughts will consume you, and you'll just cave in on yourself, and that doesn't help anybody. So, there's specific phobias, of course. Arachnophobia, hydrophobia, fear of water, like that kind of thing. Very, very specific triggers. Um, Substance-induced anxiety disorders, yeah. So addicts, right? People who abuse stuff. So obviously, um, misuse of drugs, taking your meds incorrectly. There's exposed to a toxic substance, which would be like mold or something that's not as common. And withdrawal if you're like trying to kick your habit, right? So all these can bring on anxiety. So again, substance abuse and anxiety kind of goes hand in hand, right? Which is kind of terrible, but it is what it is. So I guess I already explained that how I was when I first started getting them. It was the weed and the pills, so I just stopped both, and then I was kind of okay. But then it came back later. Like, I never really lost it, but that was the catalyst to what brought it on and what I have to deal with today. So how do I treat it now? Um, I guess the best thing you can do is to stay active. Like, you can't overemphasize it. Just even if it's just a walk. Like, if you're like severely overweight, or you're have severe social anxiety, like even just a short walk, 10-minute walk around your block, just get out of the house for a little bit. You can incrementally grow it. Like I said in another one, like, nothing has to be done all at once, right? So just do a little bit, do a little more, do a little more. But physical activity is it's big. I'm going to the gym now. That's why my arms hurt. So that's why I'm kind of just bumming around home today. Um, and I treat it with drugs, of course, as well. I have Razepam for when it gets out of control, or the instant stuff, always in my pocket. I can't leave the house without it. If I do, I turn around and go home. It's that big a problem. It's like my safety net, right? Like, I can't function unless I know it's there, right? That will instantly trigger anxiety. In fact, when I left the gym yesterday, I was like a couple hundred meters out in the parking lot, and I felt my pocket and it wasn't there. So I freaked out, ran back to the gym, searched all the lockers, couldn't find it, realized I'd left it in my gym shorts. Dumbass. So yeah, anxiety sucks. It's not fun, but maybe that helps someone. Maybe something you didn't know. So as always, if you feel like your mental health is at risk or you're in distress, you should talk. Someone will listen. Thanks.